There's over 400 symptoms that have been attributed to perimenopause and menopause, and is often dismissed by medical practitioners by saying, well, this is getting old is not for sissies.
Yes,
okay, this is your new normal. And I disagree completely with that. This is something that is often dismissed, and unfortunately, a lot of practitioners prescribe antidepressants, and that seems to be the plaster that they put on, and hopefully the patient will feel better. And that is also from not understanding what is happening physiologically in the body. Biochemically, your body is changing.
Hi there, I'm Shanine. As a certified health coach and kinesiologist, I help busy women in their 40s who feel tired, overwhelmed, anxious, frustrated and stuck to live their best years in great health and balance. Together, we'll explore a life that reflects intentional living and lays the foundation for you to live your life's purpose and flourish in your 40s. Welcome to Becoming You at 40. Welcome back to the space where we talk honestly about midlife, health, confidence, and reclaiming your worth on every level. Today's conversation is one that so many women whisper about, but almost no one talks about openly. Today we are talking about pelvic health, especially as we move through our 40s. If you've been struggling with incontinence, pressure, discomfort, or just feeling off down there, this episode is for you. And if you've never heard of something called a pelvic chair, trust me, you are going to want to stay tuned. I'm joined today by Odette, a feminine health practitioner who specializes in empowering women with sound, medically backed advice on pelvic health and the menopausal transition. Odette, welcome to the show. I am really excited to have you here today, and I look forward to this conversation.
Oh, thank you. I really believe it's a conversation that we should be having more of, so I'm just as excited to be sharing.
Yeah, that's very true. Now, just to give the listeners a bit of background, Odette and I both studied health coaching, and that's also how we met. And both of us are equally passionate about health coaching and the impact health coaching can have on improving women's health and in offering the support they need in their personal health journeys. So getting together today to discuss a topic that impacts so many women is a privilege for us, and we hope that you as listeners will find the information we share helpful and empowering. And just before we dive in, I'd love to invite you to follow the podcast so you never miss an episode. If conversations about midlife, health, confidence, and feeling worthy in your body matter to you, go ahead and hit that follow button now. It helps this message reach more women who need it, and it means you'll always have support through this community. Now, Odette, before we get into the practical tools, I want to start at the beginning. So can you please share why you are so passionate about pelvic health, and also why is this topic so under-discussed for women in their midlife?
Okay, so I think I've always had a passion. My background comes out of the pharmaceutical world, and I've always had a passion for patient education and empowering patients with good, sound knowledge that is understandable and that patients can make informed decisions about certain treatments, whether it's medical or whether it's pharmaceutical or whether it's surgical. And I think with my own journey, I found that that is not just where it ends. There are other alternatives that we can look at in alternative arenas, such as health choices and lifestyle changes and other things that work all together with conventional medicine.
Yes.
So I do have one foot in that area, but I have a passion for looking for natural alternative solutions. Yeah.
I'm also very much in the natural alternative solution sphere. For me, that's very important to have that option, and I think a lot of people don't necessarily know that they do have options. So
Yes.
I think you've just put it so beautifully now that your goal is to inform them about their options so that they can make informed choices, which I think is very, very important. Can you please tell us why is it that pelvic issues tend to surface when a woman reaches their 40s? What's happening hormonally and physically for them in this stage?
Okay, so from the age of 30, we start losing one of our very important hormones, estrogen. We start a natural decline to 1 to 2% year on year, and that affects our muscles, it affects our bones. And by the perimenopause is a period leading up to menopause.
Yes.
The average age for perimenopause has sort of been pinned around 45 to 47 years old. But women younger, from the age of 30, can also start with perimenopause. And that's often, you follow your mom's pattern. You tend to menstruate around the same age as your mother, and you go through menopause around the same age as your mom. But that's just a general measure. So how long is a piece of string? Okay, so everyone is individual.
Yes.
And you cannot, one size does not fit all. So this is a discussion that I have with many, many of my clients that come to see me. Why am I so emotional? Why am I feeling strange things? And it works from the emotional side through to the physical side, through to picking up weight, to losing hair, to losing energy. All of those things are related to perimenopause. There's over 400 symptoms that have been attributed to perimenopause and menopause, and is often dismissed by medical practitioners by saying, well, this is getting old is not for sissies.
Yes,
Okay, this is your new normal. And I disagree completely with that. And this is something that is often dismissed. And unfortunately, a lot of practitioners prescribe antidepressants. And that seems to be the plaster that they put on, and hopefully the patient will feel better.
Yeah.
And that is also from not understanding what is happening physiologically in the body. Biochemically, your body is changing.
Yes.
Your lifestyle is going to contribute whether you age well or whether you're not going to age so well.
Yes.
And of course, hormones can be very cruel, but if you learn to work with them, you can make the transition without having all those 400 listed symptoms that women have listed, and it's well documented.
Yeah.
But then it's very subjective, so it's not really it's reported. It's not scientific fact because everybody experiences it in a different way.
Right. So what I am hearing from you is that some of the transition into perimenopause and menopause contributes to our pelvic dysfunction.
Right.
Yeah.
Yes. So, but we also have another population that we could look at. We always think of perimenopause and menopause from 45 to well over going into the geriatric stage. However, there is also a population to consider, and those are your athletes who are young.
Yeah.
And if they're doing a lot of high impact, rigorous training, they can develop pelvic floor issues. And then, of course, the pregnant patient. Any hormonal change, whether it's puberty, every pregnancy, then perimenopause, and then of course menopause, you are having changes in hormones which have an effect on the ligaments softening, and depending on whether you are an active person or not, is going to determine how well you recover after pregnancy, slowing down with your rigorous exercise regime. Obviously, in perimenopause and menopause, not unless you're going on something like a hormone replacement therapy or supplementing, helping your hormone levels there, that is also going to, you can't really control that natural decline that's happening.
A lot of women might think as soon as they start with pelvic issues, they think there's something wrong with them. And they also, a lot of women think it's quite common. And I think it's dangerous to just assume that it's a normal thing. So what are some of the subtle signs that women are experiencing, but then they ignore it or shrug it off as normal?
Okay, so I have a lot of clients that confirm what studies say. The studies report that up to 40% of women will experience some kind of urinary incontinence, which is a telltale sign. Now, in your athletes, your pregnant women, and those who are having weight fluctuations, when they're carrying extra weight, they might find that when they cough or they sneeze or they lift up something heavy or they're jumping at the gym or during their rigorous training, they will have, all of a sudden they'll have leakage.
Yes.
And they might just think maybe, well, they're too embarrassed to say anything. And it's not exactly a tea time conversation with your friends because nobody's talking about it. So it's all, everybody keeps quiet about that. The other kind of incontinence that can be experienced, which is more towards the older demographic of men and women, is the urge incontinence. So that is when you think your bladder is starting to feel full and you think you need to go and empty your bladder. And when you think, before you even get to the bathroom, you've already started that leak.
Shame.
So that is, but that you can get mixed symptoms of the urge, and which is not getting to the bathroom on time, as well as the coughing and the sneezing. You can have both.
Sure.
But in our younger population, it's normally the stress incontinence. I often have clients coming saying, I've got a problem. They don't even want to tell me, yes.
Oh, shame. Yeah, because I think it's a very sensitive topic.
It is.
Yeah. Our health is always impacted by so many factors. And I think with pelvic health, it must be the same. So how does things like stress, you have mentioned perimenopause before, and you've also mentioned weight fluctuations. How does that impact our pelvic health specifically?
All right, so we've got wonderful bodies, and while we're young, we tend to not appreciate what we have, and we don't look after them. And being moms and also working, we have a lot on our plates, and we always come last.
That's so true.
So menopause, perimenopause, menopause, fluctuation in weight, all affects the pressure that you are putting on the bladder, on the pelvic floor. So those ligaments during pregnancy, and the ligaments are changing in strength with lack of estrogen as well.
Yes. Okay.
You can understand, but weight, carrying the extra weight is also putting pressure on the pelvic floor. So we always talk about core to floor, which is the core strength around your middle, which is also extends around your back. If you're strong in your core, you're most likely to be strong with your pelvic floor as well. And so our ladies who are gym bunnies or who've played sports at school tend to have start off with a strong core, and now it's about maintaining it when you start getting older.
Yes.
We should be looking at strengthening it through Pilates. We don't have to go and join a gym. We can watch it online. We can look at gentler ways of strengthening the core and the pelvic floor.
So the core and the pelvic floor is basically part of your core.
Yes.
That's how you explained it to me as well when I came to visit you in your practice. And if you can strengthen your core, you can strengthen your pelvic floor.
That's correct, yes.
Very, very interesting to know that. But like you've mentioned earlier, a lot of women are embarrassed about this, and they might not want to speak up about the pain that they endure or the sexual discomfort that they endure. What, if you can give them one message, what would that be? What would you like them to hear today?
I would love to encourage them to seek help. Yes, there are not many people. Who do you go to?
That's the thing.
That is the thing.
I think they might think they need help, but they don't know where to go.
Right.
Yeah, and that's why you are here today, to tell us where we can go.
Not all gynecologists are up to date. There's some very old school gynecologists, and I say that with all respect.
Yes.
And female gynecologists are not necessarily more informed than male gynecologists, and vice versa. So pelvic health, our physiotherapists are quite, not all of them, but some of them do specialize in pelvic health, and they do work a lot with patients that have suffered from spinal cord injuries, where they have no control over their bladders
anymore. Yeah.
So they, I think, are very glued up in terms of the anatomy and pelvic conditions that can develop from childbirth, from operations, from paralysis. So they are usually clued up. However, some of them super specialized. So they're good at physios. You get your good physios that are good with sports injuries, but they don't know much about pelvic health. So it is a little bit of a finding the right person. And I think there's more and more women like me that has gone into health coaching that is becoming more and more aware of the need to educate or to coach patients through what to do, how to do, where to do it.
Yes.
And I also have a good alliance with my pelvic health physiotherapists and sexual health doctors and psychologists. You get a lot of sexologists who are clinical psychologists. One of my mentors is a very well-known sexologist. She's Professor Elna McIntosh. She is also very passionate about educating women and empowering them with good, solid information. So there are sexologists who are practicing clinical psychologists specializing in that, your physiotherapists, your pelvic floor physiotherapists, and some of our health coach practitioners. I think that's still an emerging area.
Yes, I also don't think it's that common.
No,
Yeah.
no. So I do have a network. So there are some people who've said to me, who can I go to in Cape Town? Or who? So I do have a network of people who have a passion in this area and do treat this area.
That's so wonderful to hear that, knowledge is empowering. And I think we as women also have the responsibility to be open to learn about these things. And we need to sort of step into please help me scenario and be brave enough to take that step.
Yes.
But I think what you are saying, there's help available, just take it. I think that's important.
It is.
Yeah.
You don't have to suffer in silence.
Yeah.
And I think so many women that do come to me, I do get referrals from gynecologists. They are so relieved when they share, and I say to them, this is not the new norm, okay? We can manage it.
Yes, there is help available.
Right. And it's not to be dismissed. there is a social stigma attached to it. And when I do talk to my clients, they time everything around where the nearest bathroom is. Going to shopping centres, they immediately start scanning where's the nearest bathroom. And there's also the issue of odour, because they're wearing incontinence panty liners, and you've got to change that often. Otherwise, they're very self-aware of maybe being offensive, and it does cause a lot of insecurity, and it's not necessary.
It's a very sensitive topic for a lot of women. But you, in your practice, do have equipment that can help them. And
Yes.
you have a pelvic chair called the Imsella chair.
Yes.
Can you please tell the listeners who've never heard of a pelvic chair, how does it work? What is it?
Okay.
Please tell us.
I call it my magic throne, but it really
Lovely. I like that.
Okay, so the Imsella pelvic floor chair, it was developed specifically to exercise the Kegel muscles or the pelvic floor muscles. It's a non-invasive technique. And it uses what we call the high FEM, which is the high intensity focused electromagnetic pulse. It's a non-ionizing pulse, which is different, like your X-rays and your MRIs. They are ionized magnetic fields. So it's a non-ionized magnetic technology that is used, and that induces the supramaximal contraction. Now that's a very long word and very academic word.
My tongue would tie when I try to say that. I'll just nod my head.
Yes. That's basically the pelvic floor muscles. So if I speak to my clients, they say, how do I know where my pelvic floor muscles are? And I often tell them to go to the bathroom and then to start weeing, and then to stop the wee, to pinch. When they pinch, those are the pelvic floor muscles.
That's what contract.
Yes. And that's what needs work. So what the Imsella chair does is it's a non-invasive technique. So the clients sit on the chair, fully clothed. They sit a little bit unladylike, but that's not what we're worried about. And it's advised that they wear loose clothing. They sit with the perineum, the underneath, between the legs and the buttocks. Is that area where we will choose a program. There's 2 programs that can be chosen from, and it's a 28-minute session in which the patient or the client there will feel 26,000 contractions. And that sounds pretty weird, but
yeah, it does, and it sounds quite intense.
It is intense, and it does get some getting used to, but it's not painful. It just feels strange. It feels like you're on a very bumpy road very fast. Is one way one client explained it to me, but it is more effective than doing physical Kegel contractions. So if you had to, I always used to sit at a traffic light, and I would pinch and relax, pinch, relax, pinch, relax, and see how many I could do, which wasn't many. Believe you me, it wasn't 26,000 contractions.
No, definitely not.
I haven't done that in my lifetime. No. So 28 minutes to do 26,000 contractions. Exercise, and it's a deep muscle contraction. It's the Kegel muscles are more than just the Kegel muscles. It's the whole pelvic floor, and that's the difference between just doing your Kegel contractions. Because a lot of midwives tell the ladies after giving birth, go and do your Kegel exercises. This is far more intense, and we have medical studies that back up the science behind this technology.
You invited me a few weeks ago to come and sit on your chair. And for me, it was a bit of an intense experience. I will be honest, I've never sat on a chair like that. And I could really feel it working. And the next day, I was a bit, I wouldn't say sore, but it felt like I had a workout.
Yes.
Yeah. So
Yes.
almost like a numbing sensation.
Yes.
And I felt it for about a day or two afterwards. So it's definitely effective.
Yes.
That's for sure. So can you please elaborate more on who is the ideal client that can go for a pelvic chair treatment and who might not be?
All right. So we do recommend that ladies who have given natural childbirth come and have 6 sessions. Okay, what we normally recommend is 2 sessions a week for 3 weeks.
Okay.
So they are ideal. Anyone who is battling with every time they cough or sneeze, or when they lift up something and they're noticing that they've sprung a leak, those ladies need to seek some help there. Just a session of 6, the young ladies do respond very quickly because they're young and they've got collagen and they've got elastin fibers and their bodies are functioning very, very nicely. They're not aging, so they will bounce back literally quicker. But we have had males as well. I've always focused on feminine health because I do think it's a man's world out there. But a lot of my clients have dragged their husbands along and said he has a problem, sort him out. So we do have clinical work in males and females, clinical trial work, so that sorts out them. And then anybody in perimenopause who wants to prevent that from happening, make it part of their care, could also seek out help.
And if a woman is in perimenopause, how often should she then come for treatment?
Also 6 weeks, yes, and that treatment will last them between 12 and 24 months, depending on symptoms.
Okay, wow, that's quite a stretch.
Yeah. So it all depends on, as I said before, not one size fits all.
Yes.
So it depends on how their muscle memory works. So if you've always been active and strong and you've regularly exercised, you probably do respond much quicker and you stay in a better condition for a lot longer.
Yes, makes sense.
Yeah, but my older ladies, they come between 6 and 12 months.
Okay.
Yeah.
And then that will last them for another year or maybe even 2?
No, maybe another.
Long.
No, the older they are, it depends how active they are. Yes.
Okay.
My frailer ladies probably would come in annually as part of their...
That's part of their routine.
Yeah.
And is there a specific condition? We've been talking a lot about incontinence actually, but is there another condition, or what is the condition that the pelvic chair is most effective for?
All right, so we do use it for any issues with pelvic health. So there might be sexual dysfunction as well that's happening with those ladies, especially in perimenopause into menopause, because you start getting dryness, irritation. And those ladies tend to be more prone to urinary tract infections. And that is all part of this whole atrophy, this shrinking of just like the rest of our skin starts aging.
Yes.
You start aging inside as well. So it does help with that. It's like going back to gym and toning a few muscles. And it does have a knock-on effect in the intimate space. So a lot of ladies have come back to me and said, wow, it's like I'm on another honeymoon.
Wow.
So that has a very positive effect for those ladies who have been married a long time and they've noticed that, and we also find that the intimate health side definitely improves. Anecdotally, which means that they tell us that, but it's also backed up with clinical evidence as well.
I think you are speaking to a lot of women. Not everybody is struggling with incontinence, but there might be a woman out there struggling with painful sex and intercourse, and I think this is like a siren of help for them. And so I'm really glad that you are here to share that, because I think they need to know.
Yes.
I've seen clips on Facebook and YouTube, you know, those shorts and those reels, where women say they haven't had intimacy with their husbands for like 8 years.
Yes.
Because it's too painful.
Yes.
And I think that's really sad. And if there's help available, then get the help.
Yes, definitely.
Your marriage is worth it.
Exactly.
Yes. Yeah. Odette, please share some of your results stories. As health coaches, we love results. And I would really like to know, what success stories do you have that you can share with us?
This is the best part of the job.
Yes, absolutely.
Okay, so I always refer to the 12-year-old. She's the youngest client, but she had a congenital disorder. So she had a problem from birth, and she had to have quite a few sessions. We doubled up on those sessions, and she had 12 sessions, and the reward came the day she came in and said, "It's the first day at school today that I didn't have to wear a nappy."
Oh, wow.
And it was, she felt liberated.
She felt, imagine.
It was wonderful.
A 12-year-old girl. Oh, shame.
Yeah.
Yeah.
So I don't know what's going to happen, you know, going ahead.
Yes.
But it was just very, very rewarding.
I can just imagine.
I know that there are a couple of case studies that have been noted by the company who markets this chair, where they've had young patients like that. Also, some of the older ladies that are now widowed and no longer in an intimate relationship, and now all of a sudden they start dating again, and they say they're rather nervous now because what happens when it gets to that, with that intimate place. And I've coached them through that, and when they come back, they're just glowing, and they're just saying, "This is wonderful," and it's just lovely to see them flourish and blossom in the later stages of their lives, and not having to accept that this is normal. This is what old age is about. No, it's not. It should be liberating. It should be
empowering.
Absolutely.
And it should be a celebration of your femininity.
Absolutely.
Yeah.
And I would love to, I am busy writing a book. I'm writing several books, but I am writing about sexuality through the different stages of your life. And I've had some very amusing stories from much older ladies. And you're thinking, my gosh, you're very inspirational. You know, between 70 and 80,
Sure.
These ladies are living a very full life.
Wow.
And if they can do it, and they just celebrate their femininity in the winter years of their lives. Yeah, and it's very refreshing.
So the Imsela chair is actually giving them their life back.
You could say that. They will tell you that.
They will definitely say.
They would definitely, yes.
Yeah.
And then, I've just had young moms that have come in and said they thought their whole world had turned upside down because they thought after having these beautiful children, now they'd have damaged bodies. And it also impacted on them psychologically, being so young and having these problems now.
Yeah.
And they've come back after their treatments, because you really see a real change 3 months after you've completed the treatment. And that is just because it's like bodybuilding. You don't go and do 20 reps bicep curls, and then all of a sudden you have these biceps.
Yeah, it doesn't look like that.
It's a process.
You need to give it the time.
Yes.
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 Go through each step.
Yes. And so we just encourage women to carry on with their Kegel contractions, and to, if they have any further issues, to come back and let us know, and we'll relook at what we need to do. There's no way of measuring the amplitude of the muscle contraction. Apparently there are ways of trying, but I don't have that capability within my practice. But you know your body better than anybody else, and you know whether it's functioning where it should be or whether there's still something wrong. And we encourage those ladies to come back, and they must feel free to come back and say, I think I need a couple more sessions.
Yes.
And we accommodate that.
I love that you have just alluded to the fact that you can combine the chair with your natural pelvic floor exercises. It's not a one or the other.
No.
You can really make it a lifestyle and part of your self-care strategy for the long term.
Yes.
So I love that.
Definitely.
You have mentioned earlier about women, when they have they stage, it can impact their confidence, and that's
Absolutely.
exactly my next question. So, how does pelvic health tie into our emotional health, into our confidence, and even into our self-worth?
I have a lot of clients that come to me, and they've been battling with this for a long time. They haven't felt free to speak to their partner. They haven't felt free to speak to their practitioner, their primary care practitioner, and when they end up with me, they're quite depressed. And depression and the psychological impact of this is very, very real. And they also feel relieved that they're being heard.
I can imagine it means a lot to them that someone is there with compassion, with a compassionate ear.
Yeah.
And for you, it's not a strange thing to talk about. So you make them feel comfortable to do that.
Yes. And sometimes I do share with them how common it is. Because we think it's an old lady's disease. So that, number one, knocks your confidence, thinking, well, I'm getting older. But the thing is, as I've mentioned before, a lot of young ladies time their shopping to coincide, or they don't drink as much during the day to stop them needing that urge or that need to go and empty their bladders. So it does impact on them socially, and it impacts on them emotionally, and then the psychological combination that comes along with that. I've had ladies that are pretty much depressed about their condition, and especially those who are active, and up to 60% of active athletes suffer from leakage when they are busy with their activities, with their running or gymnastics, or the more high impact rigorous training. And that's where they normally pick up the problem, and that also is soul destroying for them.
Talking about the sport, I like to cycle. I love cycling in the morning because then I get up with the sun and the whole neighborhood, starts to wake up, and it's this energetic feel in the neighborhood. I just love it. But this morning, actually, when I was on my bike, I was thinking about our conversation that's coming up, and then I thought, I wonder what cycling does to my pelvic health. So can you maybe shed some light on that for me?
Okay, so I think it affects men more than women.
Okay.
You can get irritation. I do cycle, not every morning. I do ride I like riding the tandem because I'm the engine at the back. I don't have to think too much.
Yes.
But I do know it takes a toll on where you sit.
Yeah.
And the recommendation is to always wear the correct cycling pants. They're quite padded, and there's a special cream you can get just to stop friction from happening, because you can rub raw, and the urethra, which is the opening from the bladder, or should I say it's the tube from the bladder leading out for urination to happen. That can also get a little bit irritated. So I think if that is a problem, maybe I should invent some pants for women, because I don't know why that seat has to be so narrow and so uncomfortable. But in terms of males, there's a lot of pressure that is put along, because they have a much longer urethra, and there's a lot of pressure that pushes up against that, and that puts pressure on the prostate. And they literally, that can affect bladder emptying. So the prostate can undergo some growth after they also have hormones, and they also have hormone issues. So they haven't got away with everything.
Know it, or they won't necessarily admit to it. But yes, no, absolutely.
So yes, so there can be issues. I think any urologist would tell you that you can get issues from that, but it's not as common as in your high impact sports, running. Mentioned gymnastics, or even weightlifting. That whole
because it takes all your core muscles, and like we said
and
earlier,
now you squeeze, and then you've got a problem. So I think any urologist would say that could be a potential problem.
But just out of curiosity, the movement that goes along with cycling, is that not something that could strengthen your pelvic floor, or not necessarily? You need something more intense?
No, you would need something more intense. I would recommend for anybody Pilates, because Pilates is the ultimate in core strength.
Yes.
So it's a gentler exercise. If people don't want to cycle, I know on the roads it's pretty dangerous. But even sitting on a stationary bicycle, a lot of ladies sit on the reclining one, so they're pedaling more like that than sitting on that seat pedaling down. Yeah, I would recommend Pilates if you are really concerned about your pelvic floor, because the core and the floor are so connected.
Yes.
And that you don't have to go to a gym. You can do it online. You can do it in the comfort of your own home. There's so much more access to these things without having to incur expensive gym fees or trainers.
And you also don't need to spend a lot of time. I think even 15 minutes can already impact.
Absolutely.
And I think a lot of people forget that, and then I think, where do I have time for Pilates? And you can actually fit in 15 minutes, even just if it's 3 times a week. I think it can already benefit.
Absolutely.
Now, Odette, if you have to leave our listeners with one empowering message, what would that be?
I would like to use an analogy here. It's a story. 2 boys in a small village were saying there was a wise man sitting on a hill, and they wanted to trick him because he was always right. And the one boy said to the other boy, "How are you going to do that?" He said, "I'm going to go and catch a butterfly, and we're going to go up to see the old man, and we're going to hold the butterfly, and I'm going to say, is this creature that's in my hand alive or dead?" And he said, if the wise old man says, it's alive, I will crush it and say, no, it's dead.
Sure, okay.
And if he says, no, it's dead, I will open my hands and I will release the butterfly. And that's what my message is this morning, the answer is in your hands. We have a lot of good, solid knowledge out there. Yes, there's a lot of misinformation, and we have to try and discern what is good and what is not so good. There's a lot of rubbish on, with all due respect to people who post on TikTok and Instagram, there's a lot of people who pose as experts that do not give good, solid advice. But then again, I always encourage people to go and find out further.
Yes.
So it's very important to make sure that when you do your own research is to not just Wikipedia it or TikTok it or Facebook it, but to get some good solid information. It's a challenge, but it can be done. And it's just not all medical personnel are geared up in this area, so it is a challenge.
Yes.
But if you find a consistent message the whole time, that's probably the thread that you should be following. So go up. Don't be scared to ask questions, and go and research, go and read up, go and have a look at this. There's some very good books out there. I do follow certain people on social media that are qualified obstetrician gynecologists that are giving really good information, and there's another lady, she's an orthopedic surgeon, she is brilliant. So there are people who have credentials,
Yes.
and they're not slouches, they really have good solid information, and that's what I recommend. And that's, knowledge is power. And it's also very liberating when you realize that things are manageable. It's not the end of the world.
Absolutely. I love your analogy. So thank you so much for sharing that with us. And I love, how you expressed the most important thing is that people need to know that their health, pelvic health, general health is in their own hands. And that's what we do with coaching as well.
Yes.
We support and we guide, but you need to, the client is doing all the work, and the client is in the steering wheel. So, thank you very much for a very empowering message, and thank you for taking time out of your very busy schedule. You've got travel plans coming up, and you are running around to try and get everything done, but still you made time to come and talk to us today. So I really appreciate it. And I also just want to say thank you so much for the beautiful manner in which you share your knowledge, and you are empowering me and the listeners with the information that you share. So I really appreciate you. Thank you.
And thank you for letting me share and talk about my passion. And yes, it's a privilege. Thank you so much.
You are so welcome. Odette, if anybody would like to get in contact with you, how can they call you or email you? Where must they go?
I think the best thing to do is to, can I give my cell phone number?
If you are comfortable.
I am comfortable with that. I think it's, if they could phone me or message me, I think it's better to WhatsApp message me, because I am busy with clients, on 083 325 1148. And just leave me a message and I will get hold of you.
Perfect. What I'll also do, in the description box of the episode, I will add your phone number there.
Yes.
And then they can get the information there as well.
Perfect.
Right, thank you.
Lovely. Thank you so much.
Now, to the listeners, thank you so much for joining us today. This was such an important conversation, and I know it's going to resonate with so many women who have been suffering in silence. So please share this episode so we can reach as many women as possible. If today's conversation spoke to you, if you are ready to feel stronger, more connected to your body, and more confident in this season of life, I'd love to support you on that journey. You don't have to figure this out alone. I work with women in midlife every day who are tired of feeling frustrated, ashamed, or stuck in a body that no longer feels like theirs. So if you are curious about coaching or if you are ready to take that next step toward feeling healthier and more empowered, you can learn more about my menopause-focused programs and how we can work together at www.dayenucare.co.za. And I will also link my website in the description box, so please reach out. And to all of you listening, your body is not broken and you deserve care, support and solutions. You are worthy of comfort, worthy of confidence, and yes, worthy of becoming you. I'll see you in the next episode.